My name is Sophie and today I'm joined with Neil Armstrong to talk about the ethics of AI in relation to medical devices and medical technologies.
Nice to be here, Sophie.
You're welcome. So Neil, what are your thoughts on this?
I suppose to start off, I think it's fair to say it's a very complex subject. And actually both parts of it are. Ethics themselves are a very complex subject because when you're talking about ethics, it's not usually the black and white problems that give you any difficulty. It's the whole shades of grey areas, the what if. It's the application of ethical principles to real life that give you the difficulty. The other question is really about what we mean by AI. And AI can mean everything from a very simple numerical predicting algorithm right the way through to a deep neural network that can actually drive a car without you or conduct a surgical operation without you. So the ethics and the level of ethical control appropriate for both these sets of software can be very different. They both come under the heading of software for medical devices.
Right. Neil, would you be able to elaborate on some of those concerns for us?
Certainly. I think probably if I explain some of the differences to our normal processes, that shows some of the concerns that we've got. So typically with software, what you're told to do is to update your software regularly. Every morning to apply your bug fixes, the latest update that came in overnight, reboot your computer, reload your phone, all the rest of it. With medical devices, what we typically do is put one set of software through the regulator, and then you try not to touch anything, not to change anything, because that's your validated software, that's your validated and approved software. So your normal software practices of forever making small changes, updating, fixing bugs, fixing security issues aren't the sort of things you really want to do with medical devices. And the only way that's going to be acceptable is if you keep medical devices in a more secure operating environment.
So Neil, what about the issue of bias? Some people are worried that AI might be programmed with biases that could affect their medical treatments.
I think that's a very real issue, and we have to look at where the biases might come from. The biases might come from the people who are programming it in the first place. So you might end up with a software engineer type of bias. The bias might come from the marketplace, from the clinicians, from the hospitals, from the healthcare institutions. What do they want to see? But the real bias that we want to get in there is a bias towards the patient. What the patient wants, the care that the patient expects. Will they understand the information that they're being given? So there are diverse roles within the development of the software, all of whom may introduce a bias. There's also the bias implicit from each one of us. I'm a white male and I'm going to come with a white male set of biases. I'm also an engineer. I'm going to come with an engineering set of biases and a deep distrust of clinicians because they're not proper engineers.
Lots of good points there, Neil. How can we ensure that AI is programmed with ethical standards?
I think that's a really difficult challenge. I think one of the difficult parts of it is we've got to decide what ethical standards we want to put in there, what ethical rules we give to it.
Mhm.
We can start off with the sort of general rule of the medical profession to do no harm. But are there situations where you might not give the best possible treatment to a particular patient because you can deploy those resources more effectively to treat other patients? So if you were talking about an emergency situation, an earthquake, something like that, you apply your principles of triage. You treat those patients first who you can make most difference to.
Mm.
So even that do no harm leads on to very, very difficult areas. And what should our ethical standards be? We also talk about doing benefit risk analyses, looking at the benefit of a particular treatment over the risk. But that in itself is a very subjective thing for an individual patient. I might be perfectly prepared to take a very significant risk to improve my quality of life, but how you feel about the same improvement to your quality of life may be very different, and you may not be prepared to risk whatever you've got to achieve an improvement in quality of life that isn't particularly important to you. So very much ethical standards are going to be about the individual and need to understand the subjectivity that a patient may bring to this whole subject, and leave the patient the chance to make the final decision. What's right for me? Providing information is good. If AI starts taking decisions for people or leading people, people start feeling the computer says it must be the truth. This is when I think it gets very dangerous and we get onto very shaky ethical grounds.
Neil, do you think the current regulatory environment is equipped to handle the ethical implications of using AI in medical devices and technologies?
No, Sophie. In case that's not enough of an answer, absolutely not. Current regulations were basically written for the world as it existed in the last century. They're not written for the next decade. And we need regulation that's written for the next decade, not the last century. More particularly, we need regulation that's appropriate for the level of risk posed by AI. Simple AI doing an everyday task doesn't pose a very great level of risk. If we're thinking about autonomous equipment, that may be something very different. We also need agile regulation, something that when things go wrong, we can adapt, we can change very, very quickly, and is able to cope with a changing technological environment and to adapt quickly to advances in technology. Lastly, I think we need regulation that is erudite, that is wise, that has a degree of knowledge built into it, not something that is trying to dot every I and cross every T of what we do, but things that is setting up the big concepts for us to explore.
So, could you now discuss with me your thoughts on the interplay between medical devices and data protection in AI?
Yeah, I think this is another area where we have two conflicting issues. You come from the point very often that you want greater transparency. You want to have transparency in your medical treatment. You want to know what's going on. And yet you also want privacy of your data. You don't want other people knowing what's going on. And this is conflicting, and we've got an inherent conflict in here. And what we've got with AI is it gives us a chance not just to make more in terms of predictions based on your data, which could be useful or harmful, but it makes your data much more visible to other AI systems that could be malevolent, that could try and want to find out things that you don't want known. So you might go and visit the doctor. That visit to the doctor is being paid for by a healthcare provider, by an insurance company. Do they have the right to know all the information that's given to you?
So Neil, it is now the end of our discussion today, but this is only the beginning for our mini-series about AI.
I look forward to coming back and speaking to you again. We'll be putting up a little video every Thursday over the next few weeks, just addressing some of the issues and some of the questions I've managed not to answer today. Thank you very much, Sophie.
Thank you. Thank you, everyone.